So how do you choose the right biomaterial for a socket preservation case? So is it based off of patients, the actual defect, or is it something else?
That's actually yeah, it's a good question. The first thing to know, and I think, is with regenerative materials, essentially for bone, the most common is really allograft. So that's tissue bone that you're getting from a tissue bank, and then you're transporting that into the defect site. It really is going to turn over the quickest. So the doctor will place it, it will turn over into the patient's own bone the fastest. There's also bone that's a xenograft, and that's actually bone that's taken from an animal from another species. So typically it's cow, it's bovine. There's a lot of porcine products that are out there. I mean, I've even sold equine horse bone. It is out there.
Oh, wow.
And then there's synthetics. There's bone that's made in a lab. And
Mhm.
they're the beta tricalcium phosphates, HA hydroxyapatites, carbonate apatites. And the first thing I'll say is that probably sounds like a lot of information. It all
Mhm.
works. It will
Okay.
all work. So you can't really make an incorrect decision that will, affect the patient's health, or you can't say, oh, I used the wrong material. Uh-oh, there's going to be, they all work in different ways and for different procedures. So, my recommendation for somebody that's brand new into grafting would really be to use, either allograft particulate. I even have a little sample here. It's like a jar of bone particulate, and you can kind of pour it out in your hand like that.
Hmm.
And I said, now
And it looks like
that
salt granules,
it
like
looks like
sea
salt
salt granules.
granules.
Hmm.
Correct. And some doctors and so that's the most common, but it also can be kind of daunting because you get this and the patient has their mouth open, you've just done the extraction, you got suction going on, you got saliva, there's some blood, there's all this stuff, and you have to hydrate the bone with water or saline, and then it kind of turns into a putty, and then you get a periosteal elevator and you scoop it in. Now,
Hmm.
for some doctors that are brand new to that, it's difficult. What if the bone falls into the patient's mouth? It could get sucked up into the suction and things like that. And I get that. That's when you're brand new into that, that's definitely a consideration. That's why what's now come up is these basically resorbable bone plugs here, like this. They're pre-made, and this is bone in it. So it has synthetic bone that's made in a lab, and it's held together with like a bovine collagen glue.
Hmm.
So these are very, very popular for doctors that are brand new into socket preservation, because they're really, really easy to use.
Hmm.
So that's kind of where we're seeing more and more of this material kind of move in.
Right.
The thing I would caution any dentist getting into this, there's a lot of confusion, as they look almost identical
Right.
between a plug that has bone, synthetic bone in it, and a collagen plug. Okay,
Yes,
so
exact. I've seen that myself. Yeah.
right. So a collagen plug looks identical. The difference is the collagen plug has no mineral, no bone in it. All it is basically it's a collagen kind of cellulose that you put in, and it creates a clot, and it disappears in about 7 days. It just creates a blood clot. It does nothing to create bone. So if you started
Gotcha.
out
So
with
it's just
zero
a
bone,
hemostatic,
it's just a
correct?
hemostatic, exactly. So when you're talking about using, I graft with a bone plug, you would want to use, a product that has typically synthetic bone in it. And then you can place the implant after about 6 months, whether you do it or whether your specialist is doing it, an oral surgeon or a periodontist, or you're doing the implant yourself. So that's kind of what I've seen over the years on how this has shifted and how it's become an easier procedure to do.
Right. So how many bone plugs do you think are on the market? Like how many different brands are selling?
Yeah, I mean,
bone plug?
I would say, I mean, the product that came out first, really first to market, it's an excellent product, is a product called Osteogen. It's a
Hmm.
carbonate apatite. That's the synthetic mineral in it. And carbonate apatite's actually very close to human bone. Synthetics, for some doctors here, they may have a poor opinion of synthetics. And synthetics years ago, they weren't very good, really, just being very frank. They were brand new. Over the years, they've developed better, like carbonate apatite, that more closely resembles human bone. So you can reliably place an implant into this site in about 6 months. Now,
Okay.
we have a product that's made of the same material as Osteogen, carbonate apatite with that bovine collagen glue. It's just
Hmm.
got twice the amount of mineral. So instead of 40% of it being that synthetic bone, ours is 80%.
Does that cut down the time then that 6 months?
No, it doesn't cut down the time. The time is the same, but what it does is you can expect to have twice the bone volume in that
Okay.
socket when you're ready to place the
Oh,
implant. And
so you have
how
a stronger connection.
Right, and how you can tell that is you'll hear a term, radio opaque, right? You're taking an X-ray, a follow-up X-ray. Um, Bone material is dense. So the denser it is, the more brightly it will light up your X-ray. Now, a collagen plug will be almost dark because there's no bone in it at all. So what you'll see that with a product like Purafil compared to like an Osteogen, you'll see almost twice that lit up portion, and so
Okay.
there's more bone in it, and that's how you tell.
Gotcha. Okay. Great. Thank you for that.
Yeah, yeah. So, it's, again, for socket preservation, I think the main thing that, we want to convey is that this is a procedure it's predictable. It's one that you can get predictable results to do. And it's really again standard of care for the patient. Some patients will just say no, they'll just say I don't want it, and that's okay. But just as long as you explain that, this is what will happen, and if the patient's okay with that, that's fine. But it does need to be explained. Because what you don't want is a patient coming back in, after 6 months or a year, and they want the implant. Will say, "Well, you never told me this. I didn't know this was all going to happen." And
Right.
you want to make sure that you explain it, in a direct manner, but just let them know, and that's really the best way to go.
Right. And this might be off base, but I'm curious since it is standard of care, is are there any, is it included in any codes and any dental codes that you know
There,
of?
Yeah, there are dental codes for socket preservation and regenerative materials. Those vary between dental insurances. So typically
Right.
we don't make a recommendation because it really, as for the office, you probably know your coverage and your patient's coverage better than we would. But,
Right.
like the synthetic plugs we talked about, that would be considered a bone graft material, just like human bone would or animal bone would. So that would be how you would treat it and how you would code it. But it's a good question. So really the answer it really kind of varies from insurance to insurance, and
Of course.
that would probably be the best way to handle that.